Hi, I'm Brian Halverson and I'm a dentist. I've been in practice for over 35 years and I've written a book about my principles on holistic dentistry. The book is called Great Teeth for Life. So, what can we do about preventing tooth decay on a day-to-day basis? First thing with our young children, get them brushing their teeth as early as you can. Initially, mums and dads, you've got to do it for them. And this means gentle brushing, sometimes even starting on with just a bit of cotton wool, very, very soft toothbrush, possibly even without any toothpaste. It's important to get them used to actually having their teeth brushed, because on a day-to-day basis, brushing is really what is going to be the most effective way of preventing tooth decay. Now, tooth decay can occur in various parts of the mouth and various parts on the tooth. Now, on the back teeth, it often will occur in the biting surfaces, and this is very, very common in the younger children. Now, as we get older and the teeth get slightly tighter together, we often find the hole will occur right down tight between. And that is actually much, much more difficult to get at, and I'll explain in a few minutes how that can be done. This is where often we get tooth decay right at the gum line, and that is often because we're just not brushing quite properly. And when we brush our teeth, we should also be brushing at the join, and so you're also brushing the gum as well as the tooth. Now, often I always say that once the child can actually get to the point of understanding and brushing themselves, then it's worth seeking the advice of the dentist and the hygienist about how to have their own technique. This will vary because we've all got slightly different shaped mouths, and sometimes when baby teeth are falling out, permanent teeth are growing, then we've got a higgledy-piggledy and the difficulty of brushing becomes more intense. So this is a time when in fact seeking advice at the dentist is very, very important. Again, it's about prevention. Now, unfortunately, looking after your teeth is a little bit like washing your face. You can do it perfectly, but literally within hours, you'll get plaque building back up on the tooth. Now, plaque is the cause of tooth decay because it's basically a film that builds up on the tooth surface, and to start with is very thin, but it's actually made from the saliva, which then combines with the bacteria that naturally live in the mouth. When you add food to that, especially sugars, that's what causes tooth decay, because the sugars are converted into acids and the tooth is actually, where it's not removed, is literally dissolved away. A sort of analogy, I suppose, is a little bit like if you get a stagnation area on a car, then you'll actually get rust. And it's very, very similar with tooth decay. It's the areas which you don't clean which will actually cause or likely to cause tooth decay. So there are various techniques to be able to get all around the mouth when you're cleaning. So brushing is the most effective. Should we be using electric toothbrush? Should we be using a hand brush? Whatever suits. They've both been proven to be quite effective. Very popular is the use of dental floss. Now, the dental floss will get into those areas between the teeth which we can't normally get at, where the teeth are tight together and the brush won't get to. Again though, because of the difference in the shape of our teeth and mouths, it's much better to get professional advice over how to do it. Now, it's worth spending the time with the dentist and the hygienist, because if you get it right once, then hopefully that technique will last you a lifetime. By coming regularly to the dentist and the hygienist, what they can do is check to see if you're actually doing the job correctly. So really, this is where I think the best use of visiting the dentist is. It's not about waiting till you get a hole, it's about preventing that hole. So start as early as you can and get the right advice which is appropriate for yourself, not just purely what is theoretical. What the toothpaste manufacturers have done, which has been now introduced over the last, say, 35 years, has been the introduction of fluoride to toothpastes. Now, people have got their doubts about it, but it has certainly helped prevent much of the tooth decay that we used to see 30 or 40 years ago. And I think sometimes why the younger generation are getting early holes is because they virtually have not had their teeth exposed to the uses of things like fluoride, although again that needs professional advice to use it correctly. Now, toothbrushing should be done, I believe, about twice a day. In theory, if you could do 100% cleaning, it would actually last 24 hours, because remember I talked about the plaque building up. Well, it takes about 24 hours before it builds up to the point that it can actually become toxic to your tooth. So if you could brush totally 100%, which most of us can't, including myself, then I would say brush effectively twice a day, and that is the best way to do it. Now, there are all sorts of other ways, like water picks, like little interspace brushes, and everything else that your dentist and hygienist might do. But I do stress that get the technique right for yourself. It is by far the most prevention way of doing it. And that's some advice to prevent tooth decay. Thank you.